It has been 2 weeks since Hurricane Sandy wreaked havoc on the East Coast. Hundreds of thousands in New York and New Jersey have been left without power and water for days, long lines at the gas stations, and many people lost all of their worldly possessions. Now, to talk about some of the psychological and physical health effects, we are joined by Dr. Poonam Alaigh. And this has really been something. I was talking to some of our coworkers here at Ebru today, and we were all talking about how tired we are.
Yeah.
Just from the past 2 weeks, and you said the same thing.
It is very, it's inconvenient, and for us who have just endured inconvenience, again, it just puts things into perspective in terms of the small things in life that we take for granted and the normalcy that we expect in our lives.
Yeah, I put that light switch on, I'm like thrilled. You know?
Yeah, it's amazing, right, to have a light switch go on.
Well, what are some of the long-term health effects that we can we expect to see from people? I mean, especially from the children. Some children have been completely uprooted.
Yeah, I think it's a very good point, because during the disaster, any kind of natural disaster, you have to be careful of the health hazards, right? In terms of food safety, water safety, sanitation safety, all those things that come into play. You have to be careful that a natural disaster does not become a public health disaster, like we saw, for example, after the earthquake in Haiti, where we had a cholera outbreak as a result of sanitation issues. So the good thing is in disasters, at least in our tri-state area, we've been able to manage that. However, the surveillance and early warning system when it comes to public health has to remain very much robust during this transition.
And one of the things I want to point out, because I was out in Staten Island with a bunch of volunteers over the weekend, and they were actually saying all volunteers should have tetanus shots.
Absolutely. In fact, the Governor Cuomo, signed that as an executive order to have non-physicians, for example, pharmacists, CMT folks, all of them be able to administer tetanus shots to people coming to see them. But in terms of some of the issues that we have to look for during this vulnerable period, number one is, again, for communicable diseases. Make sure we still have safe water. We're looking for boil water advisories. Make sure that the food that we're getting, we're not using the old food in the refrigerators because the power has been out for such a long time. And the important thing is to be able to go to the physician, to have access to health care. I know the hospitals and the physicians were really affected as a result of it. Our healthcare infrastructure got affected. So to be able to keep up with your appointments, if you have chronic diseases like diabetes or hypertension, just make sure you're taking your medications, because we become you go into this recovery mode, and all you're doing is trying to get back into your normal life, and you may forget to take your medications or keep up your appointments.
That's a good point, yeah. And I also was reading, actually a girlfriend of mine is a nurse at a local hospital, and she said they've seen more patients because people were falling, and there's people's properties are destroyed, so they're cleaning up. So that's another. That's
it. And again, after Hurricane Katrina in 2005, we saw an increased incidence of patients coming in for heart attacks because of the stress that goes on after during the cleanup phase. Emotional issues, psychiatric issues, psychological issues start to flare up, especially when it comes to the geriatric population, the frail and elderly population, because they feel so vulnerable during this time, and if they're alone, it becomes a big issue. So to be able to take care of their mental health needs, making sure that the human touch and support groups are there is going to be critical.
Yeah, we kept mentioning and reminding everybody to check on their elderly neighbors. Certainly a good point there.
And the other one thing, is during the cleanup time, it's going to be critical to look for the mold, because your allergies can start kicking up. If you're not cleaning, the areas that were damp or soaked in water or flood. So you have to start looking for those areas and do really a good cleanup, so that some of the other organisms don't start.
And we're, of course, talking about hundreds of thousands of homes, and again, all those volunteers are in there as well. But what can people do? I mean, because everybody was affected. We're talking millions of people in just this area, and it just isn't Hurricane Sandy, it's any natural disaster, as you pointed out. What can people do right now to start taking care of themselves, get back to normalcy?
I think that's going to be the most important thing. And also, no matter where you are in the world, it's so important to have what is known as your own personal disaster preparedness plan. One of the things that happens where you lose, or cause damage to your property or to your loved ones, because you don't have that plan in place. So just as FEMA, and then you have something called NIMS here, which is the National Incident Management System, and the ICS, which is the Incident Command System, It's an organized way of knowing what you would do in the event of an eventuality or a disaster. Every person, every family should have that. Who are you going to, what is your communication plan going to be if you as a family gets affected? How are you going to identify your emergency alert systems or emergency relief efforts? How are you going to be able to evacuate? Who are your points of contact? What is your circle of influence? How are you going to leave and where are you going to stay? These are things that you're going to have to work on. Come up with your disaster supplies kit, whether it's your medications or your clean water or your food supplies or your gas in the cars, you know, things that we dealt with. But those are going to be important things.
And also, one thing I'll point out is plan to not have a cell phone in disasters. That's one thing that, you know, nobody had cell service for days and even weeks here in the U.S. But interesting note, they actually had in New York payphones. Became very popular.
I know, can you believe that? I used to go to the payphone.
You're right, and I used to be one of those people that said, oh, I don't need a go bag or anything like that, but now I'm actually planning for that.
And also have a family member where you can make a long distance call, because a lot of times your local calls get affected, but the long distance calls, you know, you can continue to make. So that's going to be important too.
And I think everybody just relax. It's been 2 weeks. Things are starting to get back to normal. Dr. Poonam Alaigh, thank you so much for your insight and all your great advice. Always good to have you here at Ebru today.
Thanks, Mia.